As the world prepares for the 2021 G20 Summit to be hosted in Rome on the 30th and the 31st of October this year, it is certainly the ideal time to put the spotlight on health and what we need to do globally to build a better and more secure future, not only for the globe, but certainly for the African continent too. Hello and a warm welcome. I'm Gugulethu Mfuphi, and the theme for today's live panel discussion and webinar is focused around global public health infrastructure transformation, dealing with COVID-19, AIDS, tuberculosis and malaria. Now, the conversation promises to be full of insight, solutions and considerations that both members of the public and private sector do need to consider. But joining me today to share some of their insight and details as to whether or not it's necessary to redesign the global public health architecture to meet the needs of the 21st century is a panel of African healthcare sector leaders. Let's meet them.
Dr. John Mkengasong, Director, Africa Centers for Disease Control and Prevention at the African Union Commission. Professor Willem Hanekom, Executive Director, Africa Health Research Institute. Dr. Ivy Anyebo, Takemi Fellow, Program in International Health at Harvard T.H. Chan School of Public Health. Professor Christian Happy, Professor of Molecular Biology and Genomics and Director of the African Center of Excellence for Genomics and Infectious Diseases, ACEGID, at Redeemers University, Nigeria. Dr. Penina Iotong, Bureau Chief Africa at the AIDS Healthcare Foundation. Professor Tulio de Oliveira, Director, CRISP, KwaZulu-Natal Research and Innovation Sequencing.
Well, a warm welcome to each of our panelists who will be joining us in conversation today. We certainly are looking forward to your engagement and the content and insight that you'll share with us over the next hour. But before we get cracking with this particular discussion for today, it's best for us to perhaps have further context and an understanding of where we are regarding the response and, of course, how our public sector infrastructure has been positioned on the African continent. Let's take a look at this particular pack in which we ask Professor Jeffrey Mphahlele, Vice Chancellor for Research and Innovation at the Northwest University, about the lessons that Africa can bring to combat COVID-19 in light of its experience from previous pandemics.
Africa has paid heavy price in terms of over-reliance to developed and rich countries. So for me, this is really the most important lesson Africa has learned in the recent or the current pandemic of COVID-19, because we have seen how this over-reliance can actually hamper the containment of the outbreaks and pandemics. The virus is here to stay. This simply means that Africa has to learn to really live with the virus. Even if the pace is slow at the moment, we should continue rolling out the vaccines because we know the benefits of the vaccines. And we should improve the testing in Africa because we certainly don't understand the extent of the current pandemic because of, not all countries have got the same capacity to do the testing. Maybe SARS-CoV-2 is the worst pandemic we had to face in our lifetime, but even if we do have another pandemic like COVID-19, most of the countries in the world will not be able to cope. So for Africa in particular, we need to strengthen the healthcare systems. We need to invest in surveillance. We need to invest in research infrastructure, and we need to invest in many other areas which will allow African countries to be able to predict and detect outbreaks well in advance. At least when you are faced with the pandemic, you should be able to deal with it.
Well, thank you so much to Professor Mphahlele, who's made it really clear that we do need to learn to live with this particular virus on the continent, but at the same time not rest on our laurels and ensure that there are efforts in which we invest in the right skills, infrastructure, and of course necessary surveillance in order to abate the ravaging effects of this particular pandemic. Well, that does lead us to the start of this particular panel discussion, in which we do need to take a moment to reflect on where we are positioned as a continent in light of the COVID-19 pandemic. And perhaps to start off with this particular conversation, I'd like to address our first question to Dr. John Nkengasong. And Dr. Nkengasong, as we do reflect on the global dynamics at the moment, we're well aware that the rest of the globe has been adequately dealing with the COVID-19 pandemic head-on. The African continent, though, is still facing fierce challenges when it comes to this particular environment, and really does go back to fully understanding where the shortages in our systems are regarding how best we can address the weaknesses and shortages within our system. Perhaps you can give us some insight as to where we are as an African continent in light of our response to this particular pandemic.
As a continent, we are faced with three pockets of major challenges in public health. One is the emerging and re-emerging infectious diseases. They include the COVID-19 pandemic we are dealing with. They include the Ebola outbreak, which, as you are aware, just last week, Ebola was declared again in, an outbreak was declared in the Democratic Republic of Congo. We are also faced with endemic diseases, that is the HIVs, the tuberculosis and malaria, and then the non-communicable diseases, including immunization programs. We call all three, those three pockets, syndemics. And at the center of that are some key core components that must be strengthened for the continent to enjoy good growth, both economic growth as well as health growth. And those key components include our workforce. We have to look at key workforce development across the board, nurses, epidemiologists, laboratory experts, and very importantly, innovators. We need to look at manufacturing of diagnostics, pharmaceutical, as well as vaccines in that space that will benefit every one of those three pillars. We also need to look at own investment, financial investment, which is commonly called domestic investment or Africans' own investment. We have to own the future of our health security. We now know that without that, our economic security and even national security is endangered. So we must invest in those areas there. I think it is very clear that our partnerships, just to conclude that part, with our own bilateral and multilateral needs to be reviewed. We need to look at multilateralism, where it has worked and where it needs some more reflections. We all now have to look at regionalism. What is it that the continent can do collectively, as we have seen during this pandemic, the COVID-19 pandemic, and then learn lessons from there that can allow us to redesign a public health security architecture that will speak to three different levels: the global level, the regional level, and at the local level. So I think those are the things that we need to look at, reflect, and reimagine public health. It is what we are calling a new public health order for the continent that would have to drive us going forward, given the threats, the massive threats that we face as a continent across those three pockets.
Thank you so much for that insight there, Dr. Nkengasong. And certainly, as you say, we will be building up on many of these themes to make sure that partnerships are reviewed, ensuring that we do advance the investment in various sectors that need to be explored. But as we've certainly set the theme in terms of understanding the lessons we need to learn from this particular pandemic. Dr. Eatung, I'd like to address our next question to you. In light of the slow vaccination rollout across the continent, you've been very vocal, not only about vaccine equity across the continent, but also ensuring that we need to learn from the interplay regarding experiences of various pandemics across the continent and how these need to influence further decisions as to how best we manage the COVID-19 pandemic. Dr. Eatung, perhaps if you can continue to share your insight regarding the lack of vaccinations across the continent and sluggish rollout in this regard, and of course how this needs to influence our decisions and leadership going forward.
Thank you very much. We've been very vocal regarding the lack of vaccines in Africa because we've seen that, number one, as much as the world, we all know very well that the world was very glaringly unprepared for this pandemic, and that we failed to learn from lessons of the past pandemic. When there was an opportunity for the world to actually come together with the vaccines becoming available as much as late December, in late December of 2019, 2020 rather, it's been obvious that Africa has suffered the brunt of vaccine inequity because, the availability of the vaccines meant that the Western world, considering that most of the pharma companies were based in the West, gave priority to their countries, and most of these countries, of course, are in the West. They gave priority to those countries, and Africa, because of our dependence on donations and the charitable direction with which most of our health financing has taken place, were left at the tail end. We're very unprepared to ensure that our continent was vaccinated at the same time as the rest of the world. And so this, I would say, has been a lesson for us that we should not wait for donations, we should not wait for charity, but we should be prepared as a continent to ensure we have the leadership, we have the resources to help us have a fast mover advantage, at the same pace as the rest of the world. So much as, this, hopefully that the lessons we've learned from COVID and the lack of vaccination for Africa will work for us in the future, we still have to be well prepared to ensure we can have, local production, access locally, and that we can also hold the rest of the world accountable to open that space for Africa. Because what we've seen that even if African countries, most of them had the finances or had borrowed from the Afri-Exim Bank and other resources to buy these vaccines, they were the tail end of the queue. And so that needs to change for the future. And we hope that, this realization, we can do things differently as we go forward.
Certainly, as you say, holding partners to account. Dr. Anebi, I'd like to come to you here to perhaps also share some of your learnings in terms of leadership and perhaps focusing on both the pros in terms of the leadership that has gained some ground in ensuring that the continent is able to actually address the pandemic and access vaccinations, but of course also how perhaps the faux pas need to be implemented to future leadership and understanding the skills that can be learned as we look to address further pandemics. What are your thoughts here?
Thank you very much. I actually think that one way that we can improve the global public health infrastructure is directly increasing investment in science on the African continent. When we invest in science, we also invest in scientists, and then we start to get the local leadership that we need. For so long, scientific priorities for Africa has been determined by people that are far removed from the challenges that we face on the continent. But although this is changing, there's still a lot of work that needs to be done. A lot of Africans have a lot of crucial roles to play in research and innovation that directly contribute towards achieving our sustainable economic growth for the continent. One way that we can achieve this, again, is investment. So in 2018, 10 African heads of state and government did commit to increasing investment in science and technology. But unfortunately, we haven't quite gotten there because there are other competing priorities and also resources are very scarce. But this has to be prioritized. And COVID-19 added another layer of complexity, but the pandemic, as my other colleagues have said, offers a really good opportunity to set up our priorities right and to also unleash the power of African science and support creative, sustainable and appropriate research projects that are based on the reality we're experiencing on ground. And then this gets me to my next point of increasing science investment, training the next generation of scientists. At the moment, Africa's current population stands at about 1.2 billion, and the projection over the next 30 years is that we're going to have a majority of youthful population. And at the moment, 198 researchers, we have 198 researchers per million inhabitants. And when you compare that to the UK or the US, which is basically 4,500 million per million, there's obviously a huge gap to be filled. So we need to invest in the next generation of scientists. And this also means that you invest in the education of the scientists, invest in the research interests of the scientists, and also you need to invest in the infrastructure that these scientists were working in, because at the end of the day, you don't want to train a lot of scientists and then you kind of start to lose them for through brain drain to other countries. Those are the two things that I think we can do, is invest in the science itself and invest in the next generation of scientists. So that COVID-19 has said, we actually had a lot of African researchers on ground doing all the data analysis, collecting all the samples, doing whole genome sequencing to control this COVID-19 variant, and feeding that data into the public health infrastructure that we currently have. So when you have these scientists, you have the leadership on ground to actually help us control infectious disease in the future.
Indeed, and some solid suggestions that you definitely share there, and we will delve into them in just a moment, particularly looking at some of the learnings that can be implemented in skills development, investing in the science itself, but also the people that are connected. Professor Hanekom, to build on to the opening remarks here, I'm keen to gauge your thoughts here, because as we set the tone for this conversation, perhaps it is also good that we do view policy and also sourcing African solutions that are designed on the continent and also globally competitive, but locally relevant. And I'm keen to gauge your thoughts here, Professor Hanekom, in light of your experience as to how the high-level conversations that often take place through policymakers do need to ensure that they speak to the needs on the ground in terms of delivery and access to public health care, and how it is that we need to shape the shift in infrastructure delivery. Professor Hanekom?
Yes, thank you very much, Gugu, for having me onto this panel. And I think it's an extraordinarily important conversation. And I would like to give an example of tuberculosis, and with that example, talk about that we need a comprehensive program for to address public health in Africa. And so with the COVID epidemic, what we've seen is that a number of TB deaths worldwide has gone up for the first time in years. I think in about 20 years. The latest report from the WHO about tuberculosis has just come out, and this is what it shows. And also the number of cases have still declined, but declined at much lower rates than it have been declined in the past. So what this shows to us is that we cannot put all our resources into one disease or one epidemic, but we need to look at comprehensive healthcare in our environment. And there has to be equity in how we do this, for example. And so, for example, in South Africa, in our country, we've had about 88,000 people who've died from COVID-19. But during the same period, more than 90,000 people died from tuberculosis. And we don't hear about tuberculosis at all. It's just an example of why we need a comprehensive approach to actually address our healthcare needs going forward. And I agree with the previous speakers that we cannot ignore one aspect of this to look specifically at another aspect. We need a comprehensive approach, such as John introduced at the beginning. And I absolutely agree that we actually, as a continent, need to lead these approaches ourselves. We need to generate the ways in which we're going to do it. We need to generate the funding And we need to be innovative in that. We need to generate the infrastructure, the training, all the matters that have been mentioned by previous people. We cannot wait for our northern partners to dictate what should be happening on our continent.
Very valid point there, Professor Hanekom. What I'm hearing from many of you as panelists is that we certainly need to invest in the infrastructure, in the skills, and ensuring that the delivery of these does reach the people. But something quite pertinent that you touched on, Professor Hanekom, that I'd like Professor de Oliveira to also touch on is, of course, making sure that we don't necessarily address the healthcare challenges in isolation. It does certainly highlight that we do need to have a broad bespoke approach, despite that, to ensure that we don't necessarily address one pandemic only to have another epidemic perhaps lose and gain ground in terms of the benefits that we've attained. And perhaps, Professor de Oliveira, you can give us some insight here as to how the COVID-19 pandemic and our response to it has perhaps also delayed, further backtracked some of the growth and advancements we've made against other infectious diseases, specifically around tuberculosis as well as HIV and AIDS. Your thoughts again on ensuring that we don't work in silos but have a broad address of many of the challenges that we face in the healthcare space on the continent.
Yes, thank you very much for the question. And good day to all your viewers. I think that Professor Willem Hanekom already touched on a very important subject, and as well Dr. John Kengason, on this, what we call this syndemics, what it means. Multiple epidemics happen at the same time. As Professor Hanekom highlighted, was the first time in the last 20 years that we had an increase of cases of tuberculosis. And unfortunately, we saw the same on HIV. In HIV, of course, we increasing the cases, but what we worry a lot is that in the last year and a half, we got like 22% less people that has been circumcised and close to 30% less diagnosed. What it means? It means that if we cannot diagnose the people that are being recently infected and cannot protect the people through transmission, this means that the HIV epidemic is going backwards, almost like in the last 2 years, almost went backwards a few years on the process. Why is that so important? The first thing, and that's a lot of fantastic scientific results come from South Africa and other African countries, showing the interaction between these two epidemics. So, for example, what has been found in South Africa is that people that are infected with HIV, especially the ones that are virus unsuppressed, this means they are not diagnosed, or they are not on treatment, they have twice more chance of dying of COVID infection. So that's very important, because now what we have to do, we have to synergize these two programs. We have to be able to offer HIV testing and treatment as point of COVID vaccination, and also understand what's going to be the right doses of the vaccine for people that are immune suppressed. That's another crucial question that we have to answer, and we have to answer that very, very, very fast. So what we put ourselves now in South Africa and Africa is that, fortunately, one of the positive things of this pandemic, if there is any, is that the scientific community come really, really together, both in South Africa and Africa. And I believe after that, my good friend of mine, Christian Happy, is going to be mentioning how we could really work together for the first time in the continent, both on genomic surveillance, but also partnering with hundreds of scientists to answer that question. And that's something that we want to see continuous, because if we can continue this kind of collaboration, partnership, and investment in the infrastructure and science, we may be able to use the same energy that we had to face the COVID pandemic to try to face these other three terrible epidemics in Africa: HIV, TB, and malaria.
Such valid points that you mentioned, and I'm glad that you allude to the researchers, the scientists, some of your fellow colleagues on this panel who work within those particular spaces. And Dr. Happy, this is the perfect segue to come to you, to certainly build up on how it is that we do address these syndemics, as has been mentioned by Dr. Olivier. And I'm keen to understand from your perspective, as someone who has actively worked on the ground, in the research environment, within the scientific spaces that you work in, as to how it is that we can take this multi-pronged approach to ensure that we're able to address the multiple healthcare challenges on the continent. How is it that this can not only lead to further collaboration on the continent, but making sure that it's one that also results in fruitful outcomes?
Thank you. Thank you for having me on the program. I think Tulio alluded to something that is very important. And I think collaboration is something that the COVID-19 pandemic has demonstrated that is feasible and possible in the context of Africa. We've always been told that Africa cannot collaborate, but at least we've been able to use this pandemic to debunk that. And now, in order to move forward, I think we need to invest, as a continent, both the government and the private sectors, and then the philanthropists need to invest in building infrastructures and building, and then supporting research and innovation. Because it is clear that the future of Africa and the African development is intricately related to R&D on the continent, and especially related to infectious diseases. We're talking about malaria, we're talking about TB, and then HIV. So we have demonstrated, through this pandemic that anytime given the opportunity and given the resources, Africa can rise to the occasion. And science in Africa has demonstrated for the first time that we can rise to the occasion and we can leverage the resources available, although meager, but actually to demonstrate that this continent can be resilient. You can see, for instance, the case of Tulio in South Africa, be on top of the sequencing in South Africa, uncovering variant before any other person. You could see the case in our case in Nigeria, where within 48 hours, we generated, the first genome for COVID in Africa. And this is a speed that is unprecedented. So I think it shows that, in Africa, we have the wherewithal to address issues. But then the question is, do we have enough resources and the political will in order to accelerate and then amplify this collaboration? I think Africa now can seize the moment and the opportunity and the energy that we have now in order to really move the next agenda, public health agenda of Africa, not only in the terms of laboratory, but actually catalyze, the energy and then the moment in order to come up with the right set of policy. We heard Dr. John Kingerson talking about how we can actually set up the new public health order in Africa, taking into account this endemic and setting up agendas that can actually be, that could be addressing the issues related to the world, but then also in the region and then also in countries. I think we have what it takes, in order to move Africa in the driver's seat. I've said it before, and times without number. Africa should be at the driving seat when it comes to research innovation and proposing solutions to public health and also to infectious diseases. Because we are not only endowed with natural and mineral resources, we are also endowed with these pathogens. And for us, this should be the silver lining behind it. 70% of these viruses that have pandemic potential are within us. Why can't we use and leverage them to become the world leaders into this field?
Professor Happy, I think you touched on something quite pertinent there that I'd like to dive into, and I'm keen to start off this question with you. As you say, we need to work on those collaborative efforts, get the political will in there, but of course funding and access to capital remains a critical resource that we need to unlock. Through your experience, through your institution, you've highlighted previously, Professor Happy, that there has been a great collaborative effort as well to unlock increased capital by both the public sector, the private sector, as well as the world of academia. I'd like to focus on funding and perhaps other resources that we need to unlock to ensure that investment does take place. And Professor Happy, if you could perhaps kick us off to get further clarity as to where we should mobilize this capital from. And if I can also come to Dr. Iotung to also help us to fully understand the various aspects of funding and where we need to drive the attention and focus to, given that we are dealing with syndemics, multiple pandemics at the same time. But Professor Happy, perhaps you can kick us off on the conversation regarding capital. Is it the panacea to our challenge right now?
Well, I do not think that the capital is a panacea to Africa challenge. I think priorities is actually the issue. Africa has the resources. We have both human resources, we have both natural resources, we have the resources. The question is, are we prioritizing or setting up our resources the way it should be? I think, through this pandemic, we've seen a situation whereby a continent who have failed to invest in R&D find himself begging for vaccines. And is it that, there's no ability to build vaccine manufacturing platforms in Africa? The answer is no. There is ability, because remember, in the 80s, Africa had the ability to develop vaccine for many of these infectious diseases that were plaguing many countries. But what happened? Lack of priority. We should invest. The government should invest. Remember that the Declaration of Alger and the Declaration of Abuja that requested for African government to invest about 2%, just 2% of their GDPs in R&D. That is a massive failure. Only very few African countries are putting resources in that regard. The private sector in Africa, is really not also investing, where it's supposed to be. Africa should invest where its mouth and brain is, and then you will see the revolution taking place. It is clear that when you look at the African philanthropists and the private sector, if you do an analysis, how much of the investment are they making within the continent, and how much of the investment is made outside the continent? I know about African philanthropists that will not drop a dime on this continent, but will be in places in some major universities outside Africa, making donations and then making some massive donations. I think it is clear that resources is not our problem. I think we should just prioritize, allocate the resources where it should be, and then leave the rest to both, the academia, leave to the rest to the scientists, and then leave the rest to the civil society. We have enough resources and brains on this continent to change the tide and actually change the narrative, and then take over and be in the driver's seat.
Dr. Yetung, perhaps if you could add your voice to the conversation regarding funding and, of course, access to these resources that need to be allocated accordingly.
Thank you very much. I just want to build on what Professor Happy, has just said, and the passion with which he has delivered it, because that is critical. We may have all these discussions, but if we don't have the money and the investments, nothing can move forward. And I also just want to add that, especially the African leadership needs to move away from declarations, because all these declarations are made. We had, he mentioned the Abuja Declaration. For R&D, it was 2%, but overall the agreement from the African leaders was that 15% of funding has to go, of the national funding has to go towards health. So 15% of national budgets should go towards health. But up till 2015, only 6 countries out of the other countries in Africa had actually reached that target. The same thing in 2012, there was Abuja plus 12, that built and emphasized that African leaders need to commit to leadership and governance, but also financing, and should look for innovative means of financing. So, we look at our African population, we contribute to 1.3%. We're 1.3 billion people, that's 15% of the global population. And, however, as he said, 25% of the disease burden is in Africa. When we look at malaria, 80% of the cases are in Africa. 90% of the global deaths due to malaria are in Africa. HIV is not a different story. Same as TB. And when we look at where we're getting the resources from, most of the resources, unfortunately for Africa, is still donor-driven. 75% of the AIDS funding for HIV and ARV medications is still donor-driven. So where is Africa in all of this? There's a big potential for Africa to be able to develop, whether it's on R&D, whether it's the pharmaceutical, there's a big market for that. But then the issue is still on the leadership and the prioritization to support our public sector. So the public health financing is very critical, whether we are talking about this, the current syndemics we have, and even future syndemics. If we do not invest meaningfully at an African level in the research, in the health system, strengthening to build more resilient health systems, there is no way that our response will ever be adequate. So the issue of funding is very, very critical, and it's going to be the only way that we can make a difference. And hopefully that we are learning lessons in regards to, the COVID pandemic and how it has been handled.
Certainly. Well, this is the passion that we definitely want, because this is what we need in order to source practical solutions. And perhaps, Professor de Oliveira, I can also come back to you to share further insight on the Global Fund report. As has been mentioned by your colleagues on the panel, we do have the resources, but do need to ensure that we channel more domestic investment in this particular environment and climate. Your thoughts on the Global Fund report, and of course, naturally, how we've seen certain other diseases benefit more than others. But I'm also quite keen to hear your thoughts and engage engagements with members of the investment community, if we do need to see further incentives perhaps being provided to ensure that we do unlock further capital and resources in order to assist our efforts?
Yeah, thank you. Thank you for this question. Very important one. Yeah. So, for example, one of the main reasons why South Africa did very well, at least on the science and on the genomic surveillance, is that we got investment of our own government and very early in the pandemic. Yeah. So, for example, all the work that has been done, or 90% of the work that we have done in the scientific front was funded by the Department of Science and Innovation and the South African Medical Research Council in South Africa. Very, very, very brave to throw a lot of resources on the science on the beginning of the pandemic, which seemed to have been to paid off. Yeah. And I think that now what we are coming is to a level that now we have to leverage also international resource. But as Christian had highlighted and many of the panels, with this have to be matched by national and continental resource. Because local resources are very important because then you focus on the local agenda and that allow us to really be able to really solve our own problems. We had some massive investments also now in South Africa from some philanthropists, some of them South Africans in the US, for example, Dr. Patrick Soncheong, that now is investing on constructing a manufacturing capacity to be able to produce vaccines in South Africa. The same with the WHO, the World Health Organization, created a mRNA hub with the objective of not only to produce vaccines, but to becoming a training program to the world. So we almost come in a different situation that when we didn't have access to resources and vaccines, do a lot of vaccine hoarding around the world, and that's highlighted in the Global Fund and other things. We are now investing our resources to produce the vaccines in the continent, but also to capacitate other countries in the developing world. So I think that we are in a crossroads, and with commitment of national governments and matching funding from international sources, we may be able to finally build the resources to really try to face these three epidemics together with COVID, this very big syndemics. And more important, what we current thing that we are doing, for example, with Professor Christian Happy, is to start preparing the continent to identification of virus and pathogens before they become of pandemic potential. And that's going to be crucial because we don't want to happen that again, that a virus escape and cause massive infection around the world. So we have to prepare to respond better and to respond quicker.
Certainly. And that's an element that I do want us to get into in just a moment, especially as we reflect on the investment, particularly on skills development, which we'll delve into in just a moment. However, Dr. Nkengasong, I'd like to come back to you as we have reflected not only on the resources, on the learnings from the current pandemic. We have alluded to the fact that the political world does need to be advanced upon to make sure that we are able to redesign this new global public healthcare system. But I'm keen to hear your thoughts as to how we need to do that to ensure that quality healthcare is easily accessible for all citizens of the African continent.
Any system that doesn't step back, especially after a major shock like the COVID-19, to look at itself, review itself, and then build for the future is not going to be a useful and any meaningful system. And we go through that, all organizations go through that. Systems that are put in place in the spirit of either regional or multilateral must go through that. So I think what we are calling for is to really look at where multilateralism has worked well, and then where it has expressed limitations. And we can now look at and reflect on what are those limitations and how do we repair them and move them forward. We should also acknowledge that a lot of regional efforts have been extremely successful. So we factor that into the global architecture when we redesigning or reimagining our public health security or global health security agenda. You cannot speak of global health security without regional health security. And there's no regional health security without national health security. I think that is the message, a consistent message that we have been preaching. And we have been saying, as a continent of 1.2 billion people, we need urgently to embrace a new public health order. A new public health order that would at least define what we can do regionally, bind by a treaty in several areas of manufacturing of diagnostics, pharmaceutical, and vaccines, areas of workforce development, areas of strengthening national public health institutes with the ability to do cross-border surveillance, and areas that will require that we actually be very, very deliberate in making sure that the vision that we express as a continent is supported by our partners. So the partners' efforts must align with what we are trying to do. That's the new public health order that we are proposing. But a treaty on the continent is extremely important so that that treaty can speak and digitate with the global treaties that is being discussed.
Indeed, we do need to ensure that that global treaty is aligned with some of these key themes that we need to embark upon. But I'm keen, I'm aware that Professor Hanekom, we've kept you quiet for way too long, including Dr. Ayenebu, to give us some further detail, especially when it does come to ensuring that we are able to actively invest in our human capital. But perhaps, Dr. Hanekom, this is where you can come in as well to share your thoughts in terms of ensuring that we're able to adequately invest in human capital, especially some of the learnings that you've had, particularly focused on the background on tuberculosis.
Yeah, so thank you again for that question. Very, very important. And I'm often disheartened, as has been mentioned earlier, by how many people are trained on this continent and then leave this continent and go and work elsewhere and become leaders elsewhere in the world in science. Or I think I'm very much for people going to other places to train, because often that experience brings incredible richness back to Africa. But there must be ways to make it attractive for scientists to come back to Africa and to work here. And I think from an academic perspective, which is the arena that I am working in, by far the most important thing is going to be money. All right, so if the money is available here, people will come back and will work here. And this is money, as has been talked about earlier, that invest in people and in salaries and in training other people locally, but also infrastructure and the other important aspects of that. I want to perhaps link on to what a lot of this discussion is about a new African order, but it clearly has to be within a new global order. I thought Professor Zolabera was going to give us the example of HIV and COVID-19, and if he'll ask me, I will just do this. So COVID-19 has shown us that we cannot ignore one disease, we cannot control one disease if we don't look at the comprehensive health care infrastructure, public health infrastructure. So we know, as he's mentioned, that it's likely that variants are going to emerge in people that are immune compromised. And the largest population of immune compromised people are people who are HIV infected. So if we cannot deal with the HIV epidemic, we are unlikely to control the COVID epidemic, because we are at risk of new variants emerging and us therefore not being able to control the COVID epidemic globally. Similarly, the northern countries that have done all these vaccinations are not protected if Africa is not vaccinated, and other lesser resource environments are not vaccinated. Because this allows an environment where variants of the virus can escape, and ultimately these variants may even be vaccine resistant. So what I wanted to also call for is that we need an African program, an African order in public health, but they also have to work in it, as has been said right at the start of this discussion, in a multilateral way. We have to work with our world partners. It has to be part of a huge international effort for a new public health order. Thank you very much.
Thank you for that, Professor Hanekom, and especially elaborating on the fact that if we can't deal with the HIV epidemic, then we won't be able to manage the COVID pandemic. And you alluded to Professor de Oliveira giving us more insight into this. And I've taken aback by this as a layman, an ordinary African who, again, is actively trying to participate in ensuring that more and more members of the continent are adequately participating in addressing this pandemic. But Dr. Oliveira, perhaps if I can throw this to you and then follow through with feedback from Professor Happy. If the vaccination rollout for the pandemic, the COVID-19 pandemic specifically, is just one element, how do we ensure that we continue to focus on protecting the rest of the population who are predisposed or currently infected with HIV and AIDS or tuberculosis or malaria? I guess simply I'm asking, is the COVID-19 vaccination enough to ensure that we're able to abate the threats and minimize them of the other epidemics that we have on the continent? Professor Oliveira?
Yes, thank you. Yeah, of course, that vaccination from one pathogen will not protect from development of disease by another one. Yeah, it is quite clear about that. So I think that in addition of increasing COVID vaccination, which is of crucial importance at the moment, we had enough of these waves of infection and variants, many of them emerging from Africa. Yeah, we also have to also increase a lot of the support for the other diseases. And a lot of time, public health interventions are not rocket science. Yeah, they are quite simple. Yeah, we have very effective HIV treatment. To be honest, the antiretrovirals at the moment is the best that we had in our whole history. Yeah, but we have to make sure that we can diagnose people. And for example, with HIV, we also have this fantastic rapid test. Yeah, that take a few seconds from a drop of blood. So a lot of times we do have these tools for the other pathogens, but what we have to do is go back to the basics, and make sure that as we scale COVID vaccination, we can use that to try to also scale the other processes, So for example, many of you may not know, but the only country in Africa tracked by the Global Fund that increased HIV testing during the pandemic was Nigeria, And the reason for that they decided, as they were doing the contact tracing for SARS-CoV-2, for COVID, that they would also offer HIV testing to people. So that's what we have to do. We have to use the tools that we have, but we have to use them better, and we have to really strengthen the right tools for the right pathogen. So a COVID vaccine will not protect it for development of AIDS, but antiretrovirals will as well, some very effective drugs for TB, and some fantastic news that came the last week of the first effective vaccine against malaria. But now we have to go to the basics and make sure that these tools, they arrive to the people that's most needed.
Indeed. Very valid points that you mentioned there, and I'm quite excited perhaps to hear from the voices that are representing Nigeria. But I am aware that Dr. Aniebe, I've kept you quiet for way too long, and we're happy that the line has been cleared up. But I'm keen to build up on this theme regarding that we ensure that we address all the healthcare concerns across the continent in a measured, monitored and controlled way and multi-pronged method. This is certainly where increased investment into data, unpacking the data, understanding how we actually use this data surely needs to come into effect. I'm keen to hear your thoughts here in terms of how we ensure that addressing the multiple pandemics that we have, how can we capitalize on data to allow us to mitigate the humanitarian risks that exist on the back of these healthcare concerns?
Thanks for that question. I think that improving data can help us engage properly with stakeholders and also help our decision-making processes. So when we look at COVID-19, a really good example here, availability of real-time, high-quality data for surveillance and monitoring was actually a critical success factor for COVID control of the spread of the virus. And also, when you look at other eradication programs like polio or onchocerciasis or smallpox, again, use of data was very important. The thing with malaria is that we are not engaging the way that we should with data when it comes to malaria. Malaria programs need to have more frequent high quality, and other disease programs, of course, high quality data at the national, state, and community levels. And we also have to use this data to engage stakeholders and target our interventions. Because I'm a malaria researcher, I'll just focus on malaria because there's so much that we can do to improve improve malaria programs with existing innovations that we interventions that we already have. And malaria programs should actually focus on the impact and outcomes, including frequent measurement of our prevalence and incidences. So, for example, a major survey that we do in a lot of African countries, including Nigeria, is the malaria indicator survey, which we do just once every 5 years. And this should not be so. It should be frequent enough so that we're able to track the spread of this infection. Also, performance indicators when we look at programs should also be better targeted. For example, we focus on number of nets delivered, for example, but then we also should want to understand whether all of these nets are delivered to the most population at risk, or even if this nets even achieve the desired outcome of reduced prevalence of incidences as well. I think lesson malaria can learn, which we should learn from COVID-19, is how we use the data. How can malaria data be used and presented in a more engaging way? To what extent should malaria programs rely heavily on modeling estimates to make decisions, right? And also, can we improve surveillance to also include genomic data and other high quality data in real time? And this then comes the focus of genome sequencing, which is something I'm absolutely passionate about, because when you couple genomic sequencing, like we've seen during COVID-19 on the African continent, you combine that with a traditional epidemiological approach, we then get a lot of information, and this helps us get the information that we need to help to control a spread of any disease, be it malaria, COVID-19, or Ebola.
Indeed. And I can assume that Professor Happy would certainly agree with you, right, in terms of these studies. And that leads me to ask you a question there, Professor Happy, that in order to shift the landscape with the research that you and your team do in the short to medium term, what are the 3 elements that you require in order to shift the landscape and adequately address the concerns we've been highlighting about these syndemics that we are battling with at the moment?
I think some of my colleagues have probably more or less addressed that. One is resources funding. Secondly, we need to build the capacity and strengthen the human resource capacity and strengthen infrastructure. And then third, we definitely need, to have what I call a strong dialogue. A strong understanding between the research community and then the policymakers, and how we can integrate the data that are generated through the research and into the public health system, so that those that are using the data to make policy can make informed policy and then take decisions that are informed by data. So I think clearly we need all of this, and we need a dialogue between those in the research, those doing the research, and then those making the policy. But more, and overall, I think that if we have anything to learn from this pandemic, is the fact that data and good quality data is very crucial toward any public health intervention. And therefore, I think we should just think about how, learning from this pandemic, we can set up this new agenda for the continent that is, public health agenda for the continent that is driven by data and a very strong collaboration between the research community and then the policy and the policy community.
Indeed. Dr. Eatung, I'd like to come to you to share some of your feedback as a build-up from what Professor Happy has highlighted. And it almost seems as though we need to have standardized protocol in order to ensure that should we ever be addressed with yet another pandemic, there are certain procedures and processes in place that we can follow through with as a united front, as a continent and region, to make sure that we are able to adequately address. Help us unpack how these or this particular school of thought might help us address future pandemics.
Yeah, I think it's very crucial. The aspect of standardization is very important, when we are talking about public health policies. If each country is making its own laws and going by those laws, the response will be a lot slower. But if we are uniting as an African front, we've had all these agreements in the past, and we can actually come up with policies that are standard, that help us to manage any new public health, emergency or the current public health emergencies. Those standards are very critical in helping us move faster in addressing our responses to any emergency, any public health emergency, than dealing individually. So I think going into the future, as part of what we need as a package for our response should be that we have some standard policies in place to address public health emergencies. And we have quite a number and quite some good lessons to learn from Africa. So we don't need to reinvent the wheel, but we need to have, agreement. And I think we can also borrow from what happens in the airline industry. The airline industry and even the banking sector, they operate on a set of similar rules across the board. No one country has its own rules. It's really similar rules across the board. And that helps that, for them to be able to function, optimally and more efficiently. So that's something that is also needed on the public health front. I also wanted to add the aspect, just to contribute to what my colleague said, what do we need for the global public health order going into the future? The aspect of data is very important, and we've seen that transparency, collaboration, and cooperation, in a multilateral approach regarding the data that is available is very key in what we can that can help us in the future. If we are talking about building, our R&D, some of it actually needs the support of some multilateral agreements, needs transparency in the data sharing process. If we are talking about building a hub for vaccine development and production in South Africa, some of that will need that, there's some degree of technology transfer and sharing of that data, from the other companies that have already developed that. And so those are some of the key aspects that are important, policy aspects that are similar across the board and standard for us to help us move faster and not for each individual country to work alone. And I think that is something that the African Union can, bring together all the participating members to have common agreement too. As Professor Dr. Nkengasong said, we need to start at a regional level before we can even go higher. So having that regional cooperation amongst ourselves and, having similar standards across the board for us to be able to participate and to collaborate, whether it's to build new manufacturing plants or therapeutics or whatever it is that we want as part of our response for the future, for now and for the future, those key standards are going to be very critical.
Certainly quite critical. You've mentioned a number of elements that do really speak to this future of the new healthcare order that we're certainly looking to attain. And it does really call on collaborative efforts. And as you highlighted, transparency, collaboration and cooperation. Well, Dr. Nkengasong, I'd like to throw it back to you now to share your closing remarks, I guess, on this panel, as we're well aware that towards the end of the month of October, the G20 Summit will be taking place in Rome. And I'm keen to gauge your thoughts, Dr. Nkengasong, as to what are some of the key messages that you think should be highlighted at this particular summit.
There are two key messages that need to be brought to the attention of the G20. The first message is that unless and until we vaccinate quickly and vaccinate at scale, we will collectively, as humanity and as a globe, be aging very steadily towards endemicity of this pandemic. We cannot afford to live with COVID-19 on top of other challenges that we have, the challenges that are listed at the start of this conversation. I think that is extremely important, which means we have to unite our efforts and make sure that vaccines are made accessible. So we are very grateful to partners like the United States that continue to donate large amounts of vaccines for the continent. We are very appreciative of that. And other partners that are doing similarly, the European countries, as well as the donations coming from the Chinese. I think that is very, very important. But we need to do that at scale and at speed so that we blunt the spread of this pandemic going forward. It is in everybody's interest that this vaccination is done, and then that will enable us to also stop the spread or the emergence of variants. That is very important. The second and last thing that message to the G20 will be supporting the continent to accelerate its ability to manufacture vaccines, diagnostics, and therapeutics. Again, it is all part of and should be part of the overall global health security architecture for Africa to continue to manufacture those commodities there, which are called those three commodities, health security commodities. I think those will be the two very important messages that I would like to share with or reflect on for the G20 as they meet.
Very true, and these are certainly messages that we hope representatives of the African continent will continue to take to the G20 Summit, highlighting the fact that as the African continent, we are in a unique position where we all have clearly agreed that we certainly need to see a shift and a remaking of our approach to global healthcare that remains globally competitive, however, is relevant to the markets and environments that we serve. Ongoing efforts to ensure that the research, the skills, the knowledge, and of course the resources are unlocked to ensure that we are able to adequately address not only the global pandemic that we're under, but even how this particular pandemic might even pose a further risk to the epidemics that the African continent is usually exposed to. Well, we'd like to thank my panelists for joining us here today and sharing some solid insights as to how, from a policy point of view, right down to the implementation in the livelihoods and delivery of healthcare services to Africans on the continent, that we need to ensure that we constantly work through constant transparency, collaborative efforts, and of course, unlocking and unleashing the power and access to data to adequately redress the global infrastructure healthcare concerns, primarily on the African continent. I'd like to thank my panelists for joining us this afternoon and sharing some of their formidable insight. To Dr. John Nkengasung, Director of the Africa Centers for Disease Control and Prevention under the African Union Commission, Professor Willem Hanekom, Executive Director for the Africa Health Research Institute, Dr. Ife Iniebu, Takemi Fellow and Program in International Health at Harvard T.H. Chan School of Public Health, Professor Christian Happy, who's the Professor of Molecular Biology and Genomics and Director at the African Center for Excellence for Genomics and Infectious Diseases, Redeemers University in Nigeria, and Dr. Penina Iutong, Bureau Chief Africa at AIDS Healthcare Foundation, and Professor Tulio de Oliveira, Director for CRISP, KwaZulu-Natal Research and Innovation Sequencing. Thank you so much to each of you for joining us today and really helping to assist in our feedback that you've provided. We appreciate the details and, of course, opportunities that you've identified as to how best we need to shift, redefine, and be co-creators in building back better on the African continent. We appreciate your feedback and insight, and, of course, thank you for listening and actively participating, and trust that you've gained more insight, knowledge, and most importantly, encouragement to be an active participant in building our economy better. Well, for myself, Gugulethu Mfuphi, and the team here at CNBC Africa, thank you so much for watching. Take care.